All right, what's going on, y'all? So today we're going to talk about the right way to start TRT to set you up for the most success with your testosterone replacement therapy. Doing this strategy will allow you to mitigate and avoid any negative side effects and allow you to really have good health and longevity with your TRT. So many guys now are doing things wrong, especially when they start TRT, and it causes them to one, never see the benefits of it. Two, they end up having a lot of negative side effects, can't seem to dial in the right dose. And then because of it, I'm now dealing with so many men that frankly are just doing everything they can to finally dial in the right dose, or they're wanting to come off TRT completely because it's caused more issues than benefits. So today we're going to talk about how to do TRT the right way from the start. That way you can actually get all of the benefits without any of the negative side effects. So right now what's going on, all these teleclinics, a lot of doctors, they're starting guys on way too high of a dose. So, assuming that your whole strategy with TRT is to replace your natural testosterone, get yourself, into a normal range where you can feel great, have the benefits of testosterone, but also set you up for health and longevity. Many of these clinics are over prescribing right now. And so what is causing is this honeymoon period. Whenever you go on testosterone replacement therapy for the first time, just like with any drug out there, the first 6 months to years, sometimes even several years, feels great. Even if you're at a higher than what you need dose, it'll feel great. But then over time, the positive benefits frankly start to fade into the background. You hit a new homeostasis with your dopamine, serotonin levels, everything, to where you no longer really recognize the positive benefits, and then the negative benefits or the negative side effects really start kind of hitting you in the face, from high hematocrit to emotional issues, and you just don't feel as level-headed and stable. And I'm seeing this across the board with so many men now that these clinics or doctors are prescribing a straight dose like 200 milligrams a week. They're not doing great dosing, injection frequency. A lot of these clinics are prescribing once a week doses, maybe two times a week at the most. And it's just setting up guys to maybe see benefits really early on and pay these clinics money. But then over time, they end up having more negative side effects and frankly want to come off. I'm dealing with so many guys now that are wanting to completely PCT and come off testosterone replacement therapy because they could never seem to dial in the dose. So the right way to go about doing this is to go ahead and start with your minimum effective dose. So the minimum effective dose is going to be the dose for you that really alleviates the symptoms of low T. So it gives you back your drive, gives you back your libido. You no longer have that brain fog. You can really function with good testosterone, but it's probably going to set your total T into maybe the mid-high range. Maybe for most men I'm seeing, this could be the 600 to 900 total T range, where guys feel great and they can mitigate the negative side effects. A lot of times if you do this right and you have the right dose, it's going to help you alleviate having high hematocrit. You won't have emotional issues. A lot of times you'll have that honeymoon period in the beginning, and then over time you'll feel a little bit more emotional volatile, have like a shorter fuse. We don't want that with testosterone replacement therapy. So for most men I see, a really great starting range is between 100 milligrams a week and 140 milligrams a week. Definitely 140s on the high end. When guys come to me, my sweet spot that I recommend is 100 to 120 a week. And this is most guys in the high normal range. So like I said, about 600 to 900 total T per week. And you should feel great on that dose. The other side of this is you want to have proper injection frequency. So I'll go ahead and link up a video above on how to go about injecting the proper way, but the more frequent the better. You're going to have more stable levels. It's going to mitigate negative side effects like high hematocrit. You'll keep your estrogen more in range, which will also increase emotional stability. So with that, I do recommend daily injections. Using it like an insulin needle. That way it's a super painless injection, and you doing these micro injections every day will really set you up for success. So my two biggest tips when you're starting out testosterone replacement therapy is to start with the minimum effective dose. Don't do what so many guys do. Frankly, the vast majority of guys start too high, and then over time they need to lower the dose. Start on the low end, and you can always taper up as needed. But find the minimum effective dose, and this is going to give you the greatest health and longevity. It's going to mitigate the negative side effects you hear about, potential gynecomastia, hair thinning, emotional issues. If you go ahead and you find the minimum effective dose, you're going to have basically all of the benefits with none of the negative sides. But the vast majority of guys are starting too high and then over time having to come down. And that's definitely not the right way to go about it. It's just setting up guys for more discomfort. So if you're wanting to get on testosterone replacement therapy, you're about to start getting on testosterone replacement therapy, and your whole long-term goal with this is health and longevity with better quality of life, find your minimum effective dose, start low, start in that 100 to 140 milligrams a week range. If your doctor or clinic is prescribing 200 milligrams right out the gate, tell them you don't want to start that high. That's going to put most men outside of the reference range. You might feel great on it, but over time you're going to have some negative sides with it. So go ahead, start yourself low. You can always taper up from there, and then also start with a more frequent injection frequency than what most are recommending. Daily is definitely best. Second best is every other day, and I wouldn't do less frequent than that. But let me know if you have any questions, guys. I hope this helps some of you out there. If you did, please go ahead and smash that like button, hit subscribe if you haven't already. Leave any comments or questions down below. All glory to God. God bless y'all. Have a great rest of your day.